The battle against the COVID-19 pandemic continues. Over 400 healthcare workers have succumbed to the virus in South Africa alone. Advocate Paul Hoffman says this shouldn't have been the case. He blames the large-scale corruption in personal protective equipment for unnecessary deaths. He joins us now to unpack this. Advocate, thank you very much for your time. It is, of course, a new year, and the President has pleaded with all South Africans to adhere to Level 3 regulations, threatening jail time for those who don't comply. But my question is, what about jail time for those who stole COVID-19 relief funds? We have yet to see convictions, despite those people being indirectly responsible for the deaths of more than 400 healthcare workers.
You're quite right, Anli. It's an extraordinary statistic that as many as 430 healthcare workers have succumbed in the last year. These are young, healthy, useful, well-qualified, valuable members of society, and they have been exposed to the virus because PPE, personal protective equipment, has not been made available in the quantities and in the quality that would have protected them against their untimely death. So the problem in the health system at the moment is not necessarily a lack of beds. It's a lack of personnel, which is attributable to what has been called the COVID-preneurism that has gone on in the ranks of the politically well-connected, who have chosen to use the loopholes in the urgent procurement system to enrich themselves, to buy themselves fancy new motor cars, and to leave our healthcare workers high and dry. I'm afraid the reaction of government to that has been less than satisfactory. Calling on the Special Investigation Unit to report every 6 weeks on the subject of the illegal processes that have taken place in procuring a PPE is not enough. The SIU does not have prosecutorial capacity. It is an investigative body that is basically there to claw back public money that has been misspent. What we need to stop the misspending of public money is to end the culture of impunity that is abroad in the land, in the ranks of the politically well-connected, in business and in the public administration. If people do not get issued with orange overalls, they simply carry on with their corrupt activities, as has been shown by the phenomenon of COVID-preneurism.
Advocate, we're going into the second wave and vaccine procurement is underway, albeit at a snail's pace. Do you foresee room for corruption to delay rollout even further?
Well, the sadness in this regard is that we read in the press that it is only expected that 10% of the population will ever get a vaccine in South Africa. Now, in Canada, over 900 times the number of people in Canada, the vaccine has been ordered for over 900 times the number of people in Canada. And even a country like Algeria, which is certainly not one of the leading countries in Africa, has already got this month a rollout of vaccines via Russia, which is part of the BRICS group. South Africa is in the BRICS group, but South Africa is not expecting any vaccines before the second quarter of the year. This is mismanagement, it's incompetence, and it is inexplicable in the face of the amount of human suffering, dislocation of the economy, and general mismanagement that has occurred on the watch of the Nkosazana Dlamini Zuma-led disaster.
Advocate, there is so much to talk about when we do talk about corruption. I'd love to carry on this conversation. Unfortunately, we have run out of time. We will get you back on eNCA to continue the conversation to see what kind of legal action we should be seeing or can look forward to in 2021 with regards to acting decisively against corruption in South Africa. That was Advocate Paul Hoffman, a human rights lawyer.